Good afternoon, everyone. Thank you for joining us for AGDN's Lunch and Learn. Today is a special occasion. We have two presenters, which I think is a really big deal. So thank you for everyone that's here today. I'm gonna stop talking, hand it over because there's a lot for us to cover. So David and Megan, welcome.
Hi, everybody. Thanks so much for having us. We're really excited to do this. We're happy that Anna gave us the opportunity to present today. We have a lot of stuff we're going to cover, and Anna told us that there could be a wide variety of people on the call today. So I think there's only 3 to start, which makes this question kind of fun. Is kind of on a scale of 1 to 5, how robust is your evaluation system? I know there's some small organizations and big organizations here, but since there's 3 or 4 people on, do you mind sharing where your organization is at?
I'll go. This is Laura with TIA Foundation, and I'm assuming you're referring to M&E. And I think we do pretty well with that. I teach this subject at ASU, and we have a proprietary app we use in the field that we gather data, baseline data, follow-up studies, so probably a 4.5. There's always room for improvement.
That's great. That's great. Thank you for sharing as well, Laura. Anybody else want to let us know? Or you can put your answer in the chat if you don't want to speak up, but where your organization's at, kind of on 1 to 5.
Yeah, my name is Chantal Carr. I'm with Horizon. We work in Ethiopia with microloans. And I think we're probably at a 4. We're good at collecting, but we aren't spending enough time letting the data inform the decisions necessarily. So we're getting it in, but I feel like we could really take it to a different level if we could use it, evaluate it. Yeah.
You're really going to like the second half of our talk when we talk about analysis and writing it up for diverse audiences. So that's great. Anybody else want to share?
Hi, this is Mark with Hope for Kids International. And I would say 1 or a 2. We don't have any formal evaluation metric that we use. We monitor based on the results that we see in the field and the response from our donors. I guess that's our metric right now.
That's great. Thanks, Mark. All right, well, we'll go ahead and get started. So we got kind of the gambit of responses. We're going to kind of aim for the middle, and we're open to all questions before, after, to follow up and make sure you get all the information you need for what you're doing in your organization. So we're going to start our presentation here. And I think you see my slide, right? I want to change that. You guys see just the clear slide of us now? Okay, great. All right. So today we're going to do kind of a quick about us and our evaluation work, just so you can get an idea of what we do and where we're from and the types of work we've completed. And then we'll kind of go into this wheel, which is how we think about monitoring evaluation. So there's the data and the storytelling steps, and that all really begins with the theory of change and testing the assumptions to get to where your organization wants to be, kind of in line with the mission and vision of your organization. We'll go into some of the nuts and bolts about logic models, talk about how you can help define your key indicators and what you might want to track, something that Mark might be interested in, and how you set those in motion. We'll go through the evaluation of the process. Meagan knows a bunch of different evaluation styles and metrics that she'll kind of tell us about what we could use, how we can use that information in our learning. So before we even get to the storytelling, it's how do we improve our organization, our partners, how do we share information with our key stakeholders and our funders about what we've learned through implementation, and then telling our story. And that's usually thought of as an external audience, but it also can be used as an internal thought process about how you disseminate information to internal and external stakeholders.
So I'll talk a little bit about who we are first. So we met at the International Rescue Committee in Phoenix, which is a refugee resettlement agency here in Phoenix, but it's also an international NGO. We've both traveled to conduct research internationally and in a bunch of different places, kind of different experiences with that we'll talk a little bit more about. And then we own and operate Schlinkert LLC, which is research, evaluation, and communication consulting firm. And then we really believe in strengthening communities and working with the people that are in the communities that we serve. And we also have a beautiful 2-year-old daughter who is in that super fun, talkative, chatty Cathy stage.
So if you hear her scream in the other room, we are working from home.
So I'll just give you a little bit about my experience. So I'm currently a PhD student at ASU, and I'm doing global health. And before that, I did my MPH in Baylor in Texas. And so through that and through other experiences, I've gotten to travel and collect data and also do some presentations and health education in Romania, Belize, and then some other places throughout like my undergrad. And then my current research is working with experiences of vulnerable populations here in Arizona with COVID-19. So I also have some public health work experience where, like I said, I met David at the International Rescue Committee. And so we worked on evaluating our programs, but also making sure that we could report those outcomes to our funders. Kind of the same thing with Chicanos por la Causa, working with them to make sure that children and families had good health outcomes and about monitoring and evaluating centers. And then with the Maricopa County Department of Public Health, working with healthcare providers to implement some public health programs, but also make sure that we evaluate and report back to the state and other funders.
And so I won't bore you with all of my experiences, but we'll talk about a couple of things real quickly. So I worked at Morrison Institute for Public Policy for 3 or 4 years and focused on a lot of social science, education, and health research projects that ranged from Department of Child Safety to evaluating job placements for AmeriCorps members that went through the program and how they were able to find work for the Corporation for National and Community Service. I did my dissertation research on asylum seeker health outcomes here in Arizona. I was on Esperanza's board for 3 years. It was a great experience working with Anna and her team. And now I work for the Center for Applied Research and Innovation in Supply Chain Africa, which is a research grant that pairs Arizona State University with the Kwame Nkrumah University of Science Technology in Ghana. And we're developing university practices protocols to improve research, both applied and academic, and then also expand their curriculum. A lot of that work is a lot of what we do is evaluating the progress we're making on this big grant. And so one of the most fun things we got to do together is travel to Colombia. I was a USAID research fellow for 6 months, and we were looking at dropout rates from school from previously displaced youth, and then looking at their mental health access to systems once they were back home. And it's amazing when we do all of these data analytics, but when you get to go see what people are really facing, it's pretty impressive. So this was a school that was probably about a 2-hour Jeep ride through roads that really didn't exist. And that's kind of the undercurrent to why teachers don't show up to some of these rural schools and some of the lack of infrastructure that inhibits good educational outcomes outside of major cities post the civil war that was going on in Colombia. So it's cool to be able to go and see your work as well. So what's the big why? Why is evaluation so important? I learned this when Meagan and I were working together at the IRC, and she had built this whole data infrastructure and was tracking how the individuals that were in her program were faring, right? So they tracked enrollment in services, health outcomes, transportation access. There's about 12 categories, I think, at the time. But well-being and connected to others. And it was always low, no matter how many resources she got them into. People were isolated, they were alone. So she worked with a colleague, and they got money to go, I think it was on 4 different field trips through the year, or maybe more. And it was great. I got to go on one, and it was individuals from Cuba and Colombia and Uganda and Iraq and a couple others. And we went to a spring training game. And sure enough, that's what people really needed, is they needed a reason to get out of their house and meet others and connect. And that's what eventually led to change. So it seems simple, but even data can tell you things like we need to find ways to create social cohesion between people, and that makes them feel better. So it's one of the reasons I've become very, very passionate about this topic. But that's not always the case, right? So your program, sometimes your program just started and you have no idea what to do. So you come up with a bunch of ideas about what you expect to see, and then you try to evaluate yourself in this very long-term mind frame. So having the mindset that you're going to develop, the evaluation itself is iterative and it changes over time based upon the benchmarks that you set and the types of activities you're doing that will eventually lead you to your outcome and be able to show that outcome. Do one more slide here and then I'll stop talking and let the smart one take over. But the components of evaluation, the really big one to think about, kind of the umbrella term, is your theory of change. And so your theory of change, it can be thought of sort of as like corollary to mission and vision, but it's really about testing assumptions. It's about at every link within your model that you create, the action path that you take that will lead you to your desired outcome. What is the assumption about the way the world works, and what is the assumption about how your intervention is going to really impact the desired outcome? And if you start to form all of these steps in your theory of change as research questions, you can start doing hypothesis tests, and that really helps you prove the validity of whatever you are doing. So it turns into a large series of questions, which is actually kind of fun. That maybe because we're researchers, but it makes it really exciting. So there's a lot to asking good research questions, but I think the thought process is the wheel of science. So you test, and it's important to celebrate failure. It's one of the coolest jobs about working evaluation, is you get to show, hey, this didn't work. Here's how we can change it to make it better. But being able to say that what didn't work is actually really valuable and something that big federal funders really look for. This is a big thing with USAID. They are always talking about, did you test it? What's the outcome? Did you test it? What's the outcome? To follow that, you really need to have a good understanding of your theory of change or your knowledge mobilization model. Understand why you're asking the questions you are. Like, every project should have key learning questions that you revisit throughout the project. You don't want a ton of them, but 3 to 5 is probably a good place to start. And then there's lots of books written on tips for writing good research questions. One thing that I always think of is SMART goals is something that has been developed, where you want your goal to be specific, measurable, attainable, relevant, and time-bound. But that also applies to questions. So if you can think through those questions and make them SMART based on that acronym, it can really help you formalize your outputs, which will eventually help you with your storytelling. Always stay true to the unit of analysis. It's very easy to get convoluted between the individual that's getting impacted versus the society versus the organization. So being very strategic about the specific question you're going to answer can help a lot in your program planning, in addition to your monitoring evaluation planning. And then always work with others. I always think diversity of thought is really good at every stage of the process, and it's something I encourage all teams to take part in. So there's 3 things to keep in. I also teach at ASU. I teach a statistics class, and so I won't bore you to death with a regression class right now, but it's easy to think about these things in buckets. So there's 3 types of stats, 3 things you can do with your data. You describe what's going on, you can explore the relationships between variables, and that can get very complicated, but it can be a good way to do an analysis without having to conduct a full random control trial where you're creating a full control and not. You can pull some of that out and control for variables post hoc. So if you have lots of data, like someone mentioned, that they're not using, there's ways to use that data creatively to come up with some conclusions about what you've done. And then you can compare groups, which is more of the randomized control trial setup. There's 4 threats to validity, and what you're trying to do with all research studies is remove error and bias. And these are the 4 check boxes you think about when you're trying to ensure that you're not making mistakes in your research design, implementation, analysis, and statistical write-up. So these are good to look at, and I've taken books and made them into one-pagers that can make this easier. And if people ever want that, they can reach out to me.
All right, so I'm going to discuss logic models a little bit and like the next steps of how to kind of get started. Even sometimes when you've done this a lot, that like first step of, okay, what do I need to do is kind of hard to get the ball rolling. And so for me, I think a logic model is a really helpful way to do that. It helps you think through, okay, what are we actually doing? What people, information, resources, budget, what do we need as our inputs? What are we hoping to actually do? Like what activities? Those are outputs. What kind of participation do you want? What kind of numbers do you want to see? And then your plan, like your outputs of the actual things that you're going to see and the people that are going to be a part of your program. Then your outcomes, and those can be short, intermediate, and long-term. And so you can write those all out in this way of visualizing it, so you know what you're hoping to accomplish and the steps you're going to take to get there. And CDC has a great guide to developing a logic model that like will walk you through each of the steps if you're new to this, or if you're a pro, I'm sure you already have your own way of doing things, but I think it's really helpful to like walk through each of these things. And just as the theory of change had sort of those bigger picture ideas, the logic model helps you narrow down under specific, like you could have a logic model for a bunch of different programs. And so each logic model pertains to one program, and then you're getting that outcome out there. And the theory of change might be your bigger overall thing. So your key indicators, your baseline metrics, and your monitoring. So these are all things that you want to think about as you're starting your program, maybe when you're looking at your logic model, thinking what should be included. So what do you want to be? What do you want to be known for? And where are you now? So even if you're not doing any of this, that doesn't mean what you're doing is not valuable. You're doing a lot of great, valuable things. And so where are you now and where do you want to be in the future? I think is a great thing to think about. And how are you going to get there? How are you going to track that progress? Who is going to analyze the results? Like what data are you going to capture and who's going to capture that and how's it going to get back to you? And then how are you going to write up the results, which we'll talk a little bit more in like storytelling and dissemination. I'll also do a little bit of like an evaluation overview. So there are different types of evaluation. You have formative, which you're starting out your program. It's ensuring like you have a feasible, appropriate plan. And then your process or implementation. To me, I think this one is really important because if your process is not going how you think it's going, then you're not probably going to get the results that you intended. And what you're measuring is probably not what you wanted to when you started out. And so processing, checking that people who you've hired are actually delivering the program or doing the things that you've asked them to do in the way that it's supposed to be going. Outcome and effectiveness. So what are those short-term outcomes? Is the target population actually receiving the program or intended benefits? Is that program effective? And then your impact. What's your long-term goals? Are you really seeing like a health change that you wanted to see? And sometimes that takes a really long time and that's hard to wait for. But if you have evaluation, you can see that all the things you've done up to that point are what is really impacting that person, that community, whatever you're trying to measure. And then summative, some models include this, but it's kind of looking at your program after you're done and or maybe just done with one cycle of it and really seeing what was the overall, how the program go, and then going back to the drawing board if you need to. These are just a couple of examples. These are older examples. I found a really great like peer-reviewed review article that includes a ton of evaluation frameworks. So probably anything or any way you wanted to evaluate, there's something out there. But these are two that I think kind of just sum up things really nicely. So the first one is the Centers for Disease Control and Prevention. And so they have engaging stakeholders, which is really important to involve the community that you're working with. Like, is this program, this thing, whatever you're trying to capture the evaluation about, because it's something that they want? And are you going to be able to do it and capture the things that you want with that population? And so starting there, I think, is really important. And then describing the programs, the effects you hope to see, the activities, focusing the evaluation. So getting, focusing on the areas of greatest concern, and then gathering credible evidence. And this can be done in a variety of ways. Like, are you doing more surveys? Are you capturing things in interviews? And this is like the types of data that you're collecting. And then justifying your conclusions, and then making sure those are shared. And a lot of times we share them with our organization, but we don't share them with the people that we're surveying. And so I think that's a really important thing. Like, if you're working with a population, make sure that they know what the outcomes to your evaluation or your program or whatever happened, so that they see the value in it as well. And then, of course, sharing that with the greater community is great too. The pre-seed proceed, these are acronyms. And so I will attempt to tell you all of them. But so predisposing, reinforcing, enabling factors. And so pre-seed is kind of all of your formative evaluation. And then proceed is how you're actually going to do it, like your implementation, your follow-up, and your evaluation. And so this, again, this model really focuses in on engaging your population of interest first, and then taking in all of those factors, like what is going to help your program, what do people already know about it, your enabling factors, like what is your environment that you're in, and what do people have as their own skill set already. And then sometimes, and this is more of a medical model, so it takes into genetics and health behaviors and stuff. And then going back and evaluating all those things. So it's like a planning. It can be used as a logic model too, but then also a way of evaluating that. So working with your data, I'm sure you all are collecting a lot of data, and you may not even know that you're collecting data, but you're probably getting a lot of great information. And so just sometimes it's just as easy as taking a look at your data and seeing what you have, then making sure that you do, like David said, have valid and reliable data, and then running a final analysis once your data is clean. And so this could be like big data sets, like numbers, more like quantitative statistical stuff, but also looking at interviews or small qualitative responses to things. And cleaning data is really important because just for example, I'm working on a big survey project, and it's been kind of a nightmare to see like you have all of these things that are included, and then it's like, oh wait, this shouldn't be included, and then we go back and we rerun everything, and then like, oh, you were supposed to take that out and that wasn't valid, so we get it. And it's like doing the work over and over again. So if you just start, even though it may be a time-consuming process in the beginning, like making sure you have the data that you want to look at and that it's clean, and then going to analyze, because it'll make your life easier. Ask for help along the way. There's a lot of people that can help with statistical things. There's people probably in your programs that can help make sure that you're capturing and analyzing what you want to look at, and then it can help you again avoid those early mistakes. Make sure you keep track of what you're doing. Again, in that like data cleaning process, if you took people out for a reason, like make sure that that's noted somewhere, and having a data management plan and working with other people on your teams, if possible, to do those checks and balances. And then again.
So switching to the analysis, so kind of like she said, slow and structured thinking saves time, even though it can sound like overbearing to think about all the variables you might have or all the data and all these places, but really coming up with a plan can help the analysis phase, because the computer will tell you something. if you click it, it's going to come back with an answer. But will that be the right answer? It really depends on how you've thought through all of the different metrics that you're capturing across different data sets. It's really important to analyze only one question at a time. Sometimes you go down the rabbit hole and all of a sudden it's very easy to get confused when you're trying to think about, okay, wait, where was I? So keeping a log, a syntax file, whatever the case may be, based upon the statistical package you're using. You can do some of this stuff in Excel, but then you have to write it out. That saves a lot of time. It helps with, if you have staff turnover, people understanding where the individual who was leading that analysis left off. And it also, if you want to be in an organization that's a thought leader and you want to try to work with researchers and universities to publish and to really advance the field based upon your findings, got to have reproducibility and replicability. Like you have to be able to show it and say, we would expect to see this thing 95 times out of 100 if we were to run it again. So keeping track is really valuable. And even if you don't go the academic journal route, if you're to take it to a newspaper and they want to look at your results, that's a way to really prove that you've thought it through and that you have good numbers. I think just good data management, limit the number of people that can have access. I once had a boss that said there's nothing more dangerous than people with data. So it's just be careful with who's got access to it, because I had a project once where someone deleted some really important information. And so I learned my lesson very early on, and just a word of caution. Save the data visualization separately and keep things updated automatically so you don't have to go back and redo your analysis every time. Try to create as much automation and AI in your processes as possible. So the next thing is learning. And this is fun. Like this and storytelling are fun. So we've done a lot of the nerdy research stuff, but now we get to talk about how do you improve the program? How do you make it better? How do you reach out to people to tell them about the good work you're doing? So what did you learn? And this can become kind of your mantra if you're the learning department of your organization, is what did you learn? What did you learn? Like I get this a lot in my job. It's for every activity did you do, it's not just the outcome, it's what did you learn? And so when we were talking, I think it was, who was in the beginning? Someone said that they had a lot of data, but if you can get the analysis out of it and do the evaluation, you can see not only what you should change, but what you could learn as an organization to change policies, procedures, how you can work with partners better based upon what the feedback they give you about the program and the outcomes you've seen. Creating a learning plan is really important. Learning plans can get really multifaceted because you have a lot of different target audiences. So internal to the organization, stakeholders, beneficiaries, policymakers, general public, news outlet. I mean, the list goes on and on. So creating a learning plan that targets your dissemination efforts to different groups can be really valuable if you think it through and how you're going to try to effectuate that throughout the process. And you don't have to always wait for these key metrics to happen to start this process, right? Because some metrics, if you're looking at an impact evaluation, can take 5-10 years till you see the real inputs or the real outputs from what you've created. So being able to think through what are the intermediate results and how do we learn from those as our process, our theory of change towards getting where we want to be is really valuable. And you can update those every year based upon new learnings. And this takes time and it takes resources, but it really, if you do this incremental wheel of science idea, it can really improve the effectiveness of your organization towards the outcomes you're trying to effectuate. And you can also develop targeted trainings. You can do those for your own proprietary, or you can find free resources through LinkedIn Learning, or find consultants that can come in for the specific need you've identified. So whether that's you're working with individuals that need to learn some farming technique, like finding the right person and having an individual that point you towards those resources is really valuable. And then you can do adaptive management. So once you've done all this, is you can collaborate with others, you can learn, and you can create new administrative procedures that can help you and refine your logic models, can help you do better in the subsequent year and inform future activities. The storytelling. So storytelling gets at kind of your inner journalist, right? So who is the target audience and what are you trying to accomplish? Those are the two questions you ask yourself before you write anything that's going to an external audience. And you got to think through, why would this audience care? And why should everyone care? It's important. It's funny, you do research and you might come up with your evaluation, you come up with a 20-page report, and now you got to summarize it in one sentence that will also make people interested and want to read the rest of your blog, post, newsletter, story, something in a newspaper. And it's important to tell stories that resonate with people. If you just put things in the statistics that you create, sometimes that'll land on deaf ears, because if you think of, there's tens of millions of starving people, what's one person going to do? But if you think about one person, that really drives a message home that there's something you can do. And research has shown that that method works better to get people to pay attention to your messaging. Outline your key ideas before you start writing. Pith is king. Researchers write really long reports, but you want to be specific. You want to write at an 8th grade level. You want to make it accessible to people. And all of that hard work we just talked about in the presentation, where you create your stats and your plan and you write it all up, that's a footnote. Nobody cares. Nobody wants to hear your methods or your evaluation model or your logic. Most people won't have any interest in that. So all the hard work you do goes in the footnote, and you pull out the finding and the analysis to really talk about what's important or what's the key takeaway from all of that work you've done. This last point is the integrity of your research matters, so you should never sensationalize. But I had a friend once tell me that he was a lobbyist, and he says people, including politicians, will only act when there's money, outrage, or fear involved. So know that you have to tell the story within a context, but you want to make sure that you stick true to your evaluation results, and you don't want to sensationalize, because that ruins your credibility. So the goals of your message delivery, you got to find the best medium. And there's 4 information rights that are outlined in the Kingdon model of policy change. I won't bore you with that today, but it's the right information in the right hands at the right time in the right format. And this can depend on the group you're working with. So if you're working with politicians, you might not have a ton of time, but if you have all of the materials ready to do your presentation, you can target yourself with legislative cycles to make the change or to implement what you want. But if you're doing your newsletter to try to develop donors, that's a very different audience, and you would tell the stories of your evaluations and your outcomes much differently. It's really important to segment your audience and think about these separately, not only in individual contact, but like as you build out your subscriber list or your contact list, really paying attention to who fits in what bucket. And there will be overlap, obviously, but being able to target messaging to those really matters, and taking a lot of time. Sometimes the most valuable thing you create in a project is your connections list, that comes from your network analysis or your partner database, but really taking the time to structure those so you can get the information you created to the people that can raise awareness for you, be your advocates, help you make change. That's super important. It takes a lot of time, but it's very valuable. And if you needed to conduct more market research to get a better understanding of your audience, and if you have the budget for it, that's always a good idea, so you can further target your messaging. And then this one is, I had a friend a long time ago teach me this. You always want to be reaching out to new people. You want to be reaching across, if it's not a political aisle, an ideological aisle, whatever it is it's very easy to do the poke somebody in the eye. You think differently and say something that might put them off. But if you're trying to increase your reach, your scope, tell your story to new people, I think it's really important to think where other people are coming from and meet them where you're at with your messaging, because that can really change who wants to follow you, who wants to get engaged. And if you're looking for new audiences, you think of your organization like a business, and you reach out and can really make those contacts, which will lead to long-term improvements and new resources for your organization.
So I'll just go briefly over what we just talked about. We definitely talked about like the big picture, the theory of change, like what assumptions are you building in? What are you starting to think about? And then going down to your logic models, ironing out your details, what activities, what results are you hoping for? And then those key indicators. So the things that you're really hoping to get out of it, like where you're going, what you're doing, and what you're hoping to impact. And then the evaluation piece is actually how you're doing that. And starting that from the beginning, if possible, if you're already in the middle of something, it's not too late. You can definitely get that going. And there's lots of resources for evaluation. There's a ton of different techniques. There's models, there's ways to get that going. And then logic models, I didn't really talk about them in the beginning, but you can sort of set up how you're going to evaluate based on what you see, what you put in your logic model. And so what types of data collection you're going to need, what types of surveys or interviews, and thinking about that all along this continuum so that it's built in to every step. And then what you get out of that evaluation, what you're learning, how you're going to use that for your next iteration of your program or your community event, and then really building that into storytelling for your company, for the communities you're serving, and then also for the broader audience, like David was talking about, like making it readable and making it understandable, but also don't be afraid to work with academics who may want to tell your story in a much more like detailed scientific way, because a lot of the things that you all are doing are really great things that could be replicated in other places, and your story should be told to a broader audience. And so it's this process, and it's kind of a never-ending thing, but I think each time you get closer and closer to having these really strong evidence-based programs. So that's the end of our presentation. But we're happy to take any questions, and want to hear more about what you're doing, and we love ideas. And so this is just a time for us to discuss too.
Let's start and see if there was any question in the chat. Thanks, I brought my colleagues. Great. Well, I'm glad that it looks like we got to about 11 or so individuals. So why don't I stop our share, and people can turn their videos back on if they'd like, and we can just take questions or bounce ideas. Anna, however you want to do this.
This is not a shy group, so please unmute yourself, pipe up and share your questions or experiences. Love to hear it. Go ahead, Natalie.
I actually, this was right on point, because I am going to start kind of like a research with some of the children that we're gonna just be doing the program. And this is like, I was like, okay, so how am I going to do this? So this was just perfect. And one of the things that it was coming to my mind is like, okay, so how do I start in terms of placing right there, like the right question, and how can I just do something that is not biased? Because at the end of the day, there is certain bias where I would say, I know that my program works, right? But it would be not realistic if I would just try to just, kind of like just put the verbatim right there saying, yes, it works and it's perfect. And, so how do you, like, what would you recommend me to just do? Because I'm literally at like a 0, but I'm going to start doing it and I need to do it. So how can I actually start? Do you guys have like a kind of like a guideline or something where I can just start putting my foot into water so that I can just start working on it?
I'll start, and then we'll see what David has to say. But for me, I really like the logic model stuff to kind of start, even if you have to go back out later and then come back to it. But that way you can kind of start thinking about like, what are your activities, and then what you hope, which obviously you're familiar with your program. And so you're going to know like what you hope to get out of it. And obviously that it hopefully works. But like what you hope comes out of it. And then where you can kind of unbias your results is like, what actually happened? Was it the same as what you said was going to happen? And so that I think will come later. But I think you can definitely think your program is going to be awesome, because it probably is. And so, so I think that that's a good place to start. And that's how I like to think about it, because that helps me. Like, I think I'm more visual to be like, okay, here's what I want. Here's my people. here's what they're going to do. Each person's going to do this. And then this is what I think.
And do you guys have kind of like a skeleton of like, just in terms of not publishing, but just to go and to say like, man, I did this like long time ago when I was in my country, when I was doing kind of like my thesis and going like, what would be the main question to resolve and what would be my hypothesis and my methodology and all the different type of things. Do you guys have like a skeleton of something where I could probably guide myself and go towards it?
If you email us, we have a lot of resources, like in terms of not, we don't have it, but we know where to point people in the right direction for certain questions. So it sounds like you've got the program, you want to test it, right? So the series of tests you're going to provide to see if it's working is, are you going to ask quantitative questions, qualitative questions? What are you going to measure? So it sounds like you're kind of at the tactical stage, and I can send you a host of stuff on that. I wanted to go back to your first point though. And, I think one of the things that brings credibility to what you talk about with what you're doing is accepting the things that aren't working and talking about it. Like if you read any academic paper, there's always a section on limitations, right? It's like, we know that no one has the panacea. No one has the perfect thing. Everything's a trade-off. So being able to actively discuss with whatever audience you're talking to about what we did, this X, Y, and Z worked, A, B, and C, maybe D didn't. Like being able to talk through that stuff builds you a lot of credence with the audiences you're talking to. So as you develop your metrics and you see what does work, saying what doesn't work is actually just as powerful as saying what does, because other people know not to replicate that part of your program if they try the same thing. But make sure you email me, because you can tell me kind of a little bit about your project and where you're at. And we have too much stuff about this.
Yes, I will just right after this.
We look forward to it, and congrats on getting your thing up and going from your old thesis. That's cool.
Thank you.
I have a question. How do you help? So I work in Ethiopia with some women, and they report weekly. We do a little business training, and they are all so worried about losing their loan or not being in the program. So they change their data numbers when they report them to what they think other people are saying and what they think that you want to hear. And we've tried to communicate the security that they're not going to be kicked out. What strategies have you found to use to help reduce the fear so that you can actually get true numbers and have them, they're so worried. There's so much at risk for them. They want it so bad that they just listen to what everyone else is saying and doing and try and say the same thing instead of.
So that sounds like an internal validity concern, right? You have self-selection bias and self-selection in terms of response. So there's a couple things you could probably they say they take from other people, making sure that they don't take the survey when others are around, reinforcing that they're not going to lose their benefits based upon what they answer, and then having them work with somebody to answer. So a long time ago, actually not that long, but it feels like a long time ago, I was a part of a project where, it was similar thing where it was self-reported outcomes. And if they were in this program, they got additional benefits. But so instead of just giving it to them, because they'll say, oh yeah, things keep getting better, but not too good because we don't want to time out of the program, we would complete the survey together. That might be very challenging if it's a lot of people, but you could build in like an intermediary where someone could turn that survey instrument into kind of an interview where you could really flesh out some of the details and get behind what they're really going on. And that would also give you more qualitative responses about what parts of that loan program are or are not working for them. Like, do they need it in certain increments over time? Like you could flesh out some more details about the program to kind of justify that cost.
I know, I was just thinking like observations. A lot of times that's not possible though, but Just kind of if you can, some of the metrics that you're using, like instead of, like David said, asking them if it's something that can be observed or if it's something that like someone else can answer on behalf, maybe, and that's another option. That's just what I was thinking while he was talking.
And you could also do, I don't know what metrics you're tracking, but you could also make it proof-based, right? Or so this, like if you're trying to see if they've increased their savings or their revenue, you could ask for
Like an
a
actual
pay
number,
stub,
yeah.
or I mean, there's other ways to externally validate your data that kind of remove some of that self-reported bias.
Awesome, thank you.
Yeah, thanks for your question.
Hi, I just want to introduce myself. I'm Sherilyn Leet from 6 Seconds, and we are an emotional intelligence nonprofit that operates in 200 countries and territories. And Tommaso, my colleague, was here and he had a family emergency, so he apologized. He had to leave halfway, but I'm so glad that the recording will be available because it has such valuable information to consider. Because we've had a theory of change for individual participants going through our certification processes and the education programming that we offer in various countries. But now we're thinking of a theory of change of like the whole organizational model, and which, you know, that's more his area than mine. So yeah, right, exactly. Just kind of takes it and hurts it and stretches outwardly with partnerships and expansion. But what really caught my attention from your presentation was the cues that you said about making your data more university friendly or accessible. So, you know, I'll watch the recording one more time, but if you don't mind like digging in a little deeper, we do something annually called the State of the Heart Report, which is we look at EQ patterns in various country data and essentially just put it out there. And one of our goals is to make it more readily available for other reporting needs. So, yeah.
Go for it.
Yeah.
Well, so it sounds like you create this big report and you want to make it more academic friendly.
Yes, essentially.
Okay.
Yes, because right now the people who use it are our partners or our schools who then use it and tell the teachers, like, do you notice these trends with your students? If so, what might be targeted interventions for this area? If the students are experiencing, you know, lower empathy or connection. I know you mentioned some of those examples at the beginning of the program, like social isolation or other things, which everyone globally is experiencing because of COVID. That's just a given. But it essentially, like, it helping the other people use the data then creates better targeted intervention. Yeah.
A couple thoughts. You could make an advisory board, a research advisory board to your annual report, and you could have 2 or 3 researchers be on it. They'd get a publication at it and they could really refine your questions and you could do it that way. You could make them co-authors, so they could be on your report, and then you could also do like that kind of collaborative style where they could then submit to journal articles and you get the twofer. I will say, and there's some bias in this answer. I work for Arizona State University, and it's incredible what, you know, the new model that Michael Crow is creating. Like, they want to be community embedded. They want to show their research in action. They don't want to be in an ivory tower. They want to be out working with people. So that is like a mantra from the top. And I think that's, if you look at the way funding is coming from federal grantors, I think that trend is going to continue, and universities across the country will follow suit or already are. So I think there will be a host of researchers that would be interested in this kind of proposal thought process you're thinking of. And, you know, and there are, and then, you know, it's intimidating to think about, you know, academic publications and how do we get published in a journal, but there's the traditional academic stuff, but there's this whole new audience that's for international development work with these applied journals where you could co-author these types of papers. Like the Johns Hopkins University has a great one, and there's others. USAID has their own, where they've created journal outlets for practitioners and academics to come together to further knowledge. So again, if you want to email me, I can point you in the right direction based upon what you're trying to do.
And then I was also thinking, just besides just publications, but I was just attending the American Public Health Association. And so, you know, like big conferences like that ask for just abstracts. You don't have to have this huge, you know, 15-page paper, a lot of times you can just submit an abstract, and there's, local Arizona health equity conferences, there's like smaller ones, but then there's those bigger ones too. And you could partner still with academics, but start to tell your story just maybe in conferences and that type of way too.
So helpful. And I just want to clarify, the reason you brought up the example of the funding, is it likely that my organization would need to partner with the university to then receive, go jointly to receive the funding? Or that's something that I know ASU already has, like a lot of people who specifically seek out the funding. So maybe they already have.
It could be either or.
Us or something. Yeah.
Sorry, I didn't mean to cut you off. You never tell with Zoom. I'm sorry. No, I was going to say you could do it independent of funding, where it could just be a collaboration, but you could also seek additional research funding to go together or to write specific papers based on what we have. They have like dissemination grants where you could talk about those things. You could go in together to like analyze your program and then talk about the results. So there's lots of ways and lots of funding out there to do those types of partnerships.
Thank you so much.
Thank you.
We still have a couple last minutes. Any other burning questions? Or comments from you guys, David, Meagan?
Anybody else have anything? I love hearing from people. Paul, Laura, Mark, everybody else have any? I teach, I don't mind calling on people, but
I don't have any questions, but I've been doing professional development with my team in the field because they're all doctors and one has an MPH. So to sort of get them to the next level where they can get promoted, and I feel like they could run it without me, sort of trying to do a knowledge transfer of what's in my head to them. And they were used to data collection, but of a totally different kind. And you correctly pointed out that health metrics don't move immediately. Behavior changes that drive those do, but so we do a lot of behavior measurement, and I just love the series of slides that you used. Thankfully, all of my doctors are at least bilingual, so they speak English, and I've been trying to really emphasize to them why M&E is important. I mean, we want to have continuous process improvement for sure, but also how field partners are interested in it, funders, collaborators, and so on are all interested in it, and each in different ways. Like, we randomly collected new data when we started to notice something in the field that's totally unrelated to what we do. We noticed that when we came back to do follow-up studies, that all of a sudden you could find in Mexico men and boys between 16 and 50 again. That the program, there was sort of self-development going on in those communities, and they felt less need to come to the US to work, and they were spending longer periods at home. And we're like, we need to study this and figure out why it's happening, because that's something, especially in Arizona, that's of interest to donors. We even took that data to Washington and tried to get Homeland Security interested in it, or GSA, hey, tell us where you're deporting people to. And if you help us with funding, we can do projects in those areas and reduce immigration in a more friendly manner and just more neighborly and more cost effective. But I'm going to really enjoy sharing what you guys shared with us today with my team in Mexico, because you had things in there that will prompt me to tell them which data pieces were, sort of to connect the dots, why we collect this data, why it's important. Because right now, I think they've been doing it so long, it feels a little too mechanical to them. And I want to get them like intellectually excited about the process.
That's great. Thank you. Thank
Yes,
you very
thank you.
much.
Actually, thank you.
Our pleasure.
Yeah, David, I just had a comment too. I really appreciate it. I was really interested in seeing all that information about the process, developing a theory of change and so on. I work at ASU also, so some of the few projects I've been kind of getting involved in are related to like program improvement or kind of touching on evaluation of different programs. And I think that's one challenge I'm running into sometimes is lack of available data right now. But I think knowing these processes, I think will be helpful to maybe start some conversations around, this is say the, theory of change of the program or the objectives, then this is what we could, start doing to gather data and start evaluating.
And that's a great comment. It takes a lot. And this is where you get to advocate to your boss. Like, look, you want to know X, Y, Z, here's what it would take. Here's how you could put these infrastructures. Here's the 20 indicators or 10 indicators that we want to track. And this is what it takes to do it. Like coming up with that plan could actually get you a team to be able to implement it. That's not always the easiest sell, but it's really important if you want to show people the effects of your work. So that's a great comment. Thank you.
So, yep, and I think I heard the slides are going to be available.
Yeah, we'll send them out. Yeah, absolutely. After the call.
Perfect. Thank you so much.
Thank you.
Thank you everyone for joining us today. I will be sending the slides. We will be uploading this recording to YouTube and we'll get it out to you all as soon as possible. I'm gonna stop recording now.